Dear students, today we will discuss the next topic in lifestyle diseases and prevention, that is coronary heart disease from unit number 1. Coronary heart disease, it is a form of cardiovascular disease. So we should know the basic information behind in this terminology. The letter cardio represents heart. Vascular means blood vessel. So cardiovascular disease, it means the diseases directly related to the heart blood vessels. There are different examples of diseases are available for cardiovascular disease. Among them, coronary heart disease is the one type. Okay. Major forms of cardiovascular diseases, that includes atherosclerosis, coronary artery disease, coronary heart disease, heart failure, hypertension, and cerebrovascular disease. Atherosclerosis is the progressive narrowing of the arteries, typically caused by fatty deposits. Okay. Coronary artery disease, in the sense, the same atherosclerosis problem that has happened in the arteries present in the heart, that is coronary heart disease. So if we understand the basic pathogenesis of atherosclerosis, then we can easily understand what is coronary heart disease. So atherosclerosis is a condition of unnecessary deposition of fatty materials in the blood vessels that leads to certain problems based on the organ or the geographical location where it has happened. Okay. Heart failure, hypertension, and cerebrovascular diseases are some other examples for cardiovascular diseases, in which cerebrovascular disease, that is the same atherosclerotic problem that happens in the blood vessels located in brain. Okay, that is cerebrovascular disease. Okay, now we'll discuss what is meant by atherosclerosis. The term atherosclerosis, which comes from the Greek words athros, which means gruel, and sclerosis, that means hardness. So it represents hard gruel or hard paste. That is it. Okay. It means the formation of fibrofatty regions in the intimal lining of the large and medium sized arteries, such as the aorta and its branches, the coronary arteries, and the large vessels that supply the brain. Risk factors for atherosclerosis. We can differentiate the risk factors into three major categories, like major changeable risk factors, minor changeable risk factors, non-changeable risk factors. Okay. The first one, major changeable risk factors. That means we can change all these risk factors into normal one. Okay, that is, we can avoid atherosclerosis by controlling these risk factors. That includes hypertension, high blood cholesterol, tobacco, smoking, physical inactivity, obesity, and diabetes mellitus. So through lifestyle changes, we can avoid all these risks. So that's why they are called changeable risk factors. And minor changeable risk factors includes stress, lesser omega-3 fatty acids, high alcohol consumptions. These factors can also be changed. That's why they are called minor changeable risk factors. The last category includes age, gender, heredity, and ethnicity. We cannot change these factors. That's why they are named like non-changeable risk factors for atherosclerosis, in which we'll discuss about some information of tobacco smoking that has a typical role in atherosclerotic progression. Nicotine can cause lesions in the artery wall. Carbon monoxide in the cigarette smoke is doubly damaging the blood vessels, and it causes lesions in the artery wall, and it decreases the ability of blood to transport oxygen to different cells and tissues. Physical inactivity. Exercise can lower blood pressure, it increases HDL and lower the levels of LDL and VLDL, and it reduces the stress, and it maintains the body weight and controls type 2 diabetes mellitus. That's why this physical activity risk factor comes under the category of changeable risk factor. Obesity and overweight, especially abdominal obesity, can lead to hypertension, low HDL condition, and type 2 diabetes. Diabetes mellitus, as maybe impaired ability of the blood to store glucose, is also a major risk factor for atherosclerotic progression in the human body. Okay, then commonly the risk factors for atherosclerosis can be listed like hyperlipidemia, smoking, hypertension, diabetes mellitus, insufficient physical activity, a stressful lifestyle, obesity. Okay, right. There are another important risk factor for atherosclerotic progression, that is microbial infection. There are some microorganisms have been characterized and studied, like once they infect the human body, they may trigger the process of atherosclerotic in the blood vessels. Okay, that includes Chlamydia pneumoniae, herpes virus hominis, and cytomegalovirus in erythematosus lesion has been demonstrated by immunocytochemistry. Okay, but no cause and effect relationship has been established so far. The exact mechanism behind in this infection of all these microorganisms leading to atherosclerosis has not been studied and characterized well so far. But the organisms may play a role in atherosclerotic development by initiating and enhancing the inflammatory response inside the blood vessel. Symptoms of atherosclerosis that leads to heart disease: increased heartbeat, that is tachycardia; slow heartbeat, bradycardia; chest pain; shortness of breath; dry or persistent cough; pain in the neck, jaw, throat, and upper abdomen, or even backside, that is in the back; pale gray or blue skin colored, that is called cyanosis; irregular heartbeats that feel rapid, pounding, fluttering; swelling in the legs, abdomen areas around the eyes. Okay, and these are all the major symptoms of atherosclerotic condition that may lead to a complicated heart disease in the nearby years. Okay, so again I'll list everything: higher heartbeat, slow heartbeat, chest pain, shortness of breath, dry or persistent cough, pain in the neck, jaw, throat, abdomen and back, cyanosis, irregular heartbeats that feel rapid, pounding and fluttering, swelling in the legs, abdomen or areas around the eyes. Okay, right. Now we'll discuss the pathogenesis of atherosclerosis. That is, we'll understand the mechanism behind in this issue. How far the unnecessary deposition of lipids leads to this complicated issue that results ultimately in other major heart problems. Okay, that is pathogenesis of atherosclerosis. Fatty streaks are the main factor which induces the condition atherosclerosis. These fatty streaks are thin, flat, yellow colored intimal discoloration that progressively enlarge by becoming thicker and slightly elevated as they grow in length. They consist of macrophages and smooth muscle cells that have become distended with lipid to form foam cells. These occurs regardless of geographic setting, gender or race. They increase in number until about 20 years and then they remain static. There is controversy about whether fatty streaks in and of themselves are the main precursors of atherosclerotic lesions. Hence, the research is extensively going on to understand the basic mechanism behind the atherosclerosis problems. Okay, so there is increasing evidence that atherosclerosis is at least partially the result of, that is, they have given some possible mechanisms or steps happening inside the blood vessels which leads to atherosclerosis and other major heart problems. Okay, that includes endothelial injury with leukocyte, that is lymphocyte and monocyte adhesion and platelet adherence. Second one, smooth muscle cell emigration and proliferation. Then lipid engulfment of activated macrophages, followed by the subsequent development of an atherosclerotic plaque with lipid core. So these are the major mechanism steps identified in atherosclerotic progression. Usually when we look at the cross section of the artery, the diameter will be maximum, in which the blood will flow in the normal flow rate. But once the lipid starts to deposit on the inner walls of the blood vessel, the diameter of the blood vessel will start to reduce. Okay, when we doesn't give attention to this issue, the deposition may lead to form atherosclerotic fatty streaks, which entirely reduces the diameter of the blood vessel, that ultimately increases the blood flow rate, and it gives more pressure for the heart to make the blood flow normally. At extreme condition, the diameter of the blood vessel will be restricted to minimal, whereas the blood pressure and the flow rate will be increased in the blood. And we have a common question, that is, either cholesterol is the major factor which is depositing in the atherosclerotic streaks and leads to this cardiac problems. But the answer is no. Okay, there are a lot of factors, especially oxidized LDL is the major lipid which used to deposit in the foam cells and forms the problem of atherosclerosis. The more advanced complicated lesions are characterized by hemorrhage, ulceration, scar tissue deposition. Okay, thrombosis is the most important complication of atherosclerosis. It is caused by slowing and turbulence of blood flow in the region of the plaque and ulceration of the plaque. Okay, one hypothesis of plaque formation suggests that injury to the endothelial vessel layer is the initiating factor for the development of atherosclerosis. So the possible injuries caused by different factors, that includes products associated with smoking, immune mechanism, and even hypertension. Hyperlipidemia, particularly LDL with its high cholesterol content, is also believed to play an active role in the pathogenesis of the atherosclerotic lesions. As a result of these pathogenic mechanisms, we can witness the visible atherosclerotic fatty streak that has been developed inside the blood vessel, okay, which ultimately results in the problem of coronary heart diseases. Okay, thrombus, when the condition of thrombus and atherosclerosis combines, we can witness two different issues. One is, if this happens in the coronary arteries, that is fatty deposition as well as thrombosis. If it happens in the coronary arteries present in the heart, which leads to myocardial infarction, which is familiarly known as heart attack. Suppose if the same problem happens in an important artery in the brain, that causes stroke. Okay, insufficient blood flow to the heart muscle from narrowing of coronary artery may cause severe chest pain, which is known as heart attack. Okay, right. What are the ill effects of atherosclerosis? Atherosclerosis can lead to pain in the chest known as angina. Atherosclerosis can lead to heart attack in severe conditions. It can even cause stroke when it happens inside the blood vessel of brain. There are two different important terminologies that we should know. Okay, one is angina pectoris. This is caused by the temporary lack of oxygen to the heart. Okay, we can witness this angina pectoris through the symptoms like chest, arm and neck pain. We can witness severe pain in those regions. Suppose if the individual is having angina pectoris. Okay, and second one is transient ischemic attack. It is happening when the brain is temporarily deprived of oxygen. Okay, the symptoms of transient ischemic heart attack includes headache, dizziness, loss of consciousness and inability to speak. So we should know these two terms and two different important acute complication of cardiovascular issue. These two are really temporary problems only. That is, one is angina pectoris, which is happening in the heart due to the decreased oxygen supply, and the second one is transient ischemic attack, which is happening in the brain due to the decreased oxygen supply to the brain cells. Okay, now we'll discuss how can we treat or prevent the problem of atherosclerosis. There is no specific and exact treatment has been suggested by the medical physicians community for the problem of atherosclerosis, but we have certain procedures. Okay, we'll discuss it. The decline in the cases of coronary heart disease related deaths in North America is mainly due to medical advances such as heart transplantation. This is the one suggested procedure. The second one is artificial hearts, now used as a bridge during surgery, and it will be also a possible permanent devices in the future. It is not happening now. In future it may happen. That is artificial heart implantation. Implanted pacemakers. Sometimes the heart may fail to function normally. In such case we have to place artificial pacemakers. Okay. There are two important surgical procedures are suggested by the doctors for coronary heart diseases. The number one is coronary artery bypass surgery, which is used to replace the blocked or narrowed coronary artery with healthy segments of other arteries. So the arteries from other part of the body may be taken out and it will be used to replace the narrowed artery due to atherosclerotic issue. This coronary artery bypass surgery has different types, that includes single coronary hypod bypass surgery, double bypass surgery, triple bypass surgery and quadruple. This difference is purely based on the number of replacements, how many number of arteries are replaced with the help of healthy artery that has been taken away from the other part of the same individual. Okay, right. The next surgical procedure suggested for coronary heart disease is angioplasty, that is enlarging the artery by using a balloon based stent. A metallic stent will be inserted. Initially the atherosclerotic plaques will be started to deposit inside the walls of the blood vessel, and then once the case is diagnosed, then the medical physicians will suggest to go for the angioplastic surgery, in which the balloon will be inserted inside the blood vessel to the target location with the help of a thin and flexible catheter, which tries to enlarge the narrowed blood vessel, and then it places a metal based stent which enlarges the diameter of the blood vessel for the normal blood flow. Okay, there are some other treatment options are also available for coronary heart diseases, that includes drug which targets to lower the blood pressure, blood cholesterol, and it may increases the diameter of the blood vessel and used to stabilize the heart rate. Okay, some improvements are also necessary in case of healthcare management system, that includes emergency services and cardiac rehabilitation programs, public awareness and education campaigns. Okay, Then regular screening is also a suggested method for the monitoring of coronary heart disease progression in the individuals. Sometimes aspirin tablets are also suggested to some individuals in rare cases, which has the capacity to decrease the tendency of blood to clot inside the blood vessel, and it is a very rare procedure since it has a lot of side effects that has been characterized already. Okay, and some preliminary lifestyle changes are suggested to manage coronary heart diseases. That includes avoid smoking, healthy eating habits, regular physical exercises, stress management, control diabetes or control the risk of developing diabetes, avoiding alcohol consumption and other drugs. These are all the major lifestyle changes that has to be implemented to the individuals who wish to manage atherosclerosis followed by coronary heart diseases. American medical associations have given some dietary recommendations for those individuals that includes balanced calorie intake and expenditure, eat nutrient which are rich in all the sort of nutritional substances that includes whole grain, fruits and vegetables, eat fish which are rich in omega-3 fatty acids twice in a week, eat lean meats, choose low-fat dairy products, low cholesterol and sugar in the diet, and reduce the intake of sodium, which has the capacity to trigger the blood flow rate. That is, it has the capacity to increase the blood pressure. Okay, so these are all the major recommendations suggested by the American Medical Association. So students, so far we have discussed what is meant by coronary heart disease and what is the difference between coronary heart disease and cardiovascular disease. What are all the major diseases that are example for cardiovascular diseases. We have started to discuss about the basic mechanism behind in the progression of atherosclerosis, major risk factors, symptoms of atherosclerosis. Okay, and then we discussed the diagnostic idea behind in cardiac issues, and then the major preventive measures and treatment suggestions available for coronary heart diseases. In the next class, we'll discuss with a new topic. Already I have shared the notes of lesson for this topic to you, so please go through it. If you have any clarification, you can contact me. Thank you.